Health. Definition of health. Health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Examples to make good health. High population. Strong indicator of the health of the population is rising, which is generally by increasing and improving the nutrition and health care. Mental health. Mental health refers to health of the individual, emotional and psychological. According to WHO, there is no definition of formal mental health. Cultural differences, subjective assessments, and competing professional theories all you want to find a definition of mental health. In general, most experts agree that mental health and mental illness are not the two isotopes. In other words, the absence of a mental disorder is not necessarily an indicator of mental health. Self-care, the achievement of health, and conservation is a difficult process and effective. There are effective strategies to ensure the health of the individual and improve the health of the individual and include the following elements. Nutrition. USDA Food Pyramid, which was published in 2005, is evidence of general nutrition. Nutrition is the science that studies how what people eat and what affects the health status, such as foods or food components that cause diseases or deteriorate health, such as eating too many calories, which is a major factor in obesity, diabetes, heart disease. Field food and nutrition, and also studying dietary supplements that improve performance, promote health, treatment or prevention of diseases, such as eating fibrous foods to reduce the risk of colon cancer, or with vitamins O, CMOs to strengthen teeth and gums, as well as improving the immune system. Personal health, and partly depends on the social structure of life, maintaining a strong social relations and conditions associated with good health and longevity, productivity, and a positive attitude. This is due to the fact that positive social interaction, as seen by many participants, increase the levels of chemicals in the brain that are associated with intelligence and personality. This basically means that positive reinforcement from a third party makes a person more socially adept, and helps to relax physically and mentally. Sports and nutrition focus on how food and dietary supplements affect athletic performance, improvement from training and recovery after events and training. One goal of sports nutrition is to maintain glycogen levels and prevent glycogen depletion. Another objective is to improve energy levels and muscle. There is a specific strategy to win the sport. An event could include a timetable for a full season of what should be dealt with sports, and minute quantities before, during and after and between events and exercises. Participants in endurance sports such as the full-distance triathlon eat according to a specific diet. Sports and nutrition are working hand in hand with sports medicine. Sport is the most important practices to reduce the weight also. Physical exercise. Exercise is the performance of movements in order to develop or maintain physical fitness and public health. It is often also in the direction of honing the skills or athletic ability. These practices through frequent and regular movements. Exercise is an important element in the prevention of certain diseases such as cancer, heart disease, diabetes type 2, obesity and back pain. Clean hygiene is to keep the body clean to prevent infection and disease, and avoid contact with infectious agents. Practices include hygiene, bathing, cleaning teeth, washing hands especially before eating, washing food before it is eaten, and the preparation of food, clean utensils and surfaces before and after preparing meals, and others. This may help in the prevention of disease. By cleaning the body gets rid of dead skin cells and bacteria. Some problems of health. Smoking. When your parents were young, people could buy cigarettes and smoke pretty much anywhere, even in hospitals. Ads for cigarettes were all over the place. Today we're more aware about how bad smoking is for our health. Smoking is restricted or banned in almost all public places, and cigarette companies are no longer allowed to advertise on TV, radio, and in many magazines. Almost everyone knows that smoking causes cancer, emphysema, and heart disease, that it can shorten your life by 10 years or more, and that the habit can cost a smoker thousands of dollars a year. So how come people are still lighting up? The answer, in a word, is addiction. Once you start, it's hard to stop. Smoking is a hard habit to break because tobacco contains nicotine, which is highly addictive. Like heroin or other addictive drugs, the body and mind quickly become so used to the nicotine in cigarettes that a person needs to have it just to feel normal. People start smoking for a variety of different reasons. Some think it looks cool. Others start because their family members or friends smoke. Statistics show that about 9 out of 10 tobacco users start before they're 18 years old. Most adults who started smoking in their teens never expected to become addicted. That's why people say it's just so much easier to not start smoking at all. Infection. This term broadly refers to any abnormal condition that impairs normal function. Commonly, this term is used to refer specifically to infectious diseases, which are clinically evident diseases that result from the presence of pathogenic microbial agents, including viruses, bacteria, fungi, protozoa, multicellular parasites, and aberrant proteins known as prions. An infection that does not produce clinically evident impairment of normal functioning is not considered a disease. Non-infectious diseases are all other diseases, including most forms of cancer, heart disease, and genetic disease. Tuberculosis. Tuberculosis is a common and often deadly infectious disease caused by various strains of mycobacteria, usually Mycobacterium tuberculosis in humans. Tuberculosis usually attacks the lungs but can also affect other parts of the body. It is spread through the air when people who have the disease cough, sneeze, or spit. Most infections in humans result in an asymptomatic, latent infection, and about 1 in 10 latent infections eventually progresses to active disease, which, if left untreated, kills more than 50% of its victims. Asthma. Asthma is a chronic condition in your lungs that has two main components. When you have asthma, two things happen inside your lungs: constriction, the tightening of the muscles surrounding the airways, and inflammation, the swelling and irritation of the airways. Constriction and inflammation cause narrowing of the airways, which may result in symptoms such as wheezing, coughing, chest tightness, or shortness of breath. Furthermore, there is increasing evidence that, if left untreated, asthma can cause long-term loss of lung function.